Doctors of Reddit, what is your most surprising "I can't believe I need to have this conversation with an adult" story? I had severe asthma as a kid. I was intubated for a severe attack a few times. My parents were instructed to take better precautions in our home and went through instructions, more dusting, washing bedsheets etc., and the big one, no smoking inside the house. So my parents agreed to all of this. Few weeks later I'm back in the hospital. A doctor recognized me and came over to talk. Then he bent over and smelled my head. I'll never forget that. I thought it was so weird. He told a nurse to sit there and not let me leave with my parents. When my parents showed up he asked point blank, "Did you not understand what I told you last time? Do you understand these attacks could be fatal? But we open windows and have stopped smoking in her room when we put her to bed." Skeptical smiley face. Not a doctor, but my human sexuality professor in grad school had some interesting stories. He worked a lot in very conservative Christian communities, and so a lot of times people got married with no sex education. He had one couple who couldn't get pregnant. Turns out they thought sleeping together literally meant sleeping in the same bed. Another couple was in therapy because neither one of them enjoyed sex or ever had an orgasm. After having them talk through step by step what they did in bed, he learned the guy was just sticking it in and nothing else. He told the guy to move back and forth next time and see what happened. The couple came back one more time to say thank you, and didn't need any more sessions. That second story is probably my favorite in the thread. Thank you. I saw a patient for a follow-up after 3 visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2 to 4 hours with no relief. This raises suspicion to me, as the same meds are working in the ER. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Banaka and swallows. I felt really bad. He had never received any education about his illness or medications. We had a diabetic patient who kept coming back with extremely high sugars. We asked him if he was following the regimen we taught him, testing his blood sugar, using the sliding scale, measuring the correct dose of insulin in the syringe etc. He went through all the steps and it sounded like he was doing everything right. We asked him to demonstrate the steps he took so we could observe and correct any mistakes he may have been making. He did everything right until the very last step. He drew up the insulin in his syringe, pulled an orange out of his bag, injected the insulin into the orange, then ate it. Turns out when he was taught to practice how to give himself subcutaneous injections with oranges, he didn't realize he actually needed to inject himself for the insulin to do its job. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like as a solider would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped, and it wasn't to help her walk on her post-op knee. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor. HIV education and awareness in China is severely lacking, even for educated doctors. Source was Chinese. Edit: Chineses in nationality, not ethnicity. There was a nursing student I had once who laughed loudly and exclaimed, "How can you possibly get an STD in your mouth? Ah, the innocence of youth. That having sex gets you pregnant." It was a 20-plus-year-old woman that couldn't grasp the idea that sex leads to pregnancy. She thought that in order for a man and a woman to have children, they needed to be married first and then have a baby. That sex was just an act unrelated to it. Then again, we are talking about a small rural community in the middle of fucking nowhere, Mexico. Edit: my highest rated comment. Awesome, thank you. Also, it's amazing how common this misconception is all around the world. My friend is a student doctor and is on placement at a small-town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. That coming to the ER for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the ER for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ER with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. This hits hard for me. I had an uncle who I was very close to who was very sick the entire time I knew him. I know he had very severe diabetes, but I don't remember what else he suffered from. I have these distinct memories of him taking me to McDonald's so we could throw the fries to the seagulls that hung out in the parking lot, and he'd always have the heat on full blast because the circulation to his extremities was so poor. By the time he died, he lost both of his legs and 4 of his fingers. Irony was he loved basketball so much. He used to chase me around with his leg nubs and race me down the street in his electric wheelchair. He was really amazing. He never let me be afraid of his amputations or his condition. I even used to give him insulin shots even though needles scare the shit out of me as an adult. He was a remarkable human being. I miss him and I wish he could have known me as a real developed person. Unfortunately, I was 6 when he died. I hope he'd be proud. Edit, fuck guys, you're all so nice. Thanks to all of you who reached out and said nice shit to me, it made my night. I'm in a place in my life where I could really use the positivity, so I really appreciate it. Another edit, because thank you for the gold. A mother came in with her son to discuss treating his acne. Son was about 15 years old and didn't really care about the acne, but mom did. After going over treatment options, she asked if he just needed to do it to get rid of the acne. A grown woman with a child thought that by him having sex his acne would magically go away. SMH. Edit, it seems that many people think that having being a teenager equals acne, thus having sex makes you a man and you would no longer have acne. Odd thought process emo. Also, WTF is up with the whole broken arms thing? Edit 2, rip my inbox. Thank you for all the responses and clarification on the broken arm incest saga. I feel like I've officially become a Redditor and learned one of its darkest secrets. Patient comes in at 2 a.m. for insomnia, clearly tweaking her brains out, heart rate 200. Can't sit still, bouncing off the walls. I suggest maybe easing up on the cocaine. But doctor, I love cocaine. I don't want my baby to get a vaccine because Jenny McCarthy's book says her son got autism from the thimerosal in his MMR vaccine. Jenny McCarthy is a one-time Playboy model who wants to sell you her books. MMR is a live vaccine and does not contain thimerosal. Thimerosal contains ethylmercury, which clears from your body in approximately 10 days, unlike methylmercury, which stays for months and actually causes damage. Measles killed 135,000 people in the world last year. Autism has a strong genetic component. If one identical twin has it, there is a 75% chance the other will as well. With 75% of identical twins both having autism. Andrew Wakefield faked the research linking autism to MMR vaccine, lost his license to practice medicine, and made millions helping lawyers sue and selling books. He lives in a mansion in England. I went to school for 11 years, spent 10,000 hours studying, and just want to make sure your child stays healthy. Quit thinking your 5 minutes of internet research means anything, get over yourself, and vaccinate your damn baby. Not a doctor, but when I was in Afghanistan, a local man came up to us on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor, so we got the medic to go see him and I helped unwrap his hand, and it was just fucking huge. He'd cut his hand very badly and, for whatever reason, kept it submerged in diesel for 3 days before seeking help. His hand appeared to have soaked up a shitload of diesel, or it was just infected to fuck, but it resembled a water balloon and lightly touching it caused it to piss liquid. It was NAAASTY. That the 30-plus cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. 30 plus, man, I'm such an amateur. Your heart thanks you for your amateur ways. I'm a paramedic and recently transported an idiot who self-presented to the local hospital, who found he was having a heart attack STEMI, and needed him sent to a bigger hospital for treatment. During my assessment I asked him how long he'd been having chest pain. On and off for 12 months, he tells me. Any family history? One of the biggest indicators. Oh, yes. Dad died of a heart attack. Brother died of a heart attack. Both of them first presentation, stone dead on the spot, no fucking about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relatives spontaneously chucking hearties and dying, and you've never got it investigated. Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. So I'm only an EMT, but I want to weigh in here to this conversation. I had to tell a patient with severe pneumonia and the patient's family that you don't get sick, i.e. catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. Edit. I just want to say to everyone who flooded my inbox with wonderful sentiments regarding the work of EMTs and paramedics. That appreciation makes dealing with the seemingly inexorable chorus of professionals telling us, me, otherwise much easier. My parents always told me that the reason I got sick was because I wore t-shirts to bed. Yes, mother, I got the flu because I exposed my forearms and hands as I slept, not because half the kids at my school were probably off dying from it. Hands? TF you supposed to wear? Nurse here. Retired after 27 years on the job. The number of American 20-somethings that don't know if they're circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, are you circumcised? If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, what's that, is way too many. For the record, I can count the number who were uncircumcised on 2 hands. I knew a guy who I'm 99% sure was circumcised who thought that he was not because circumcision is when you cut off the head of the penis. Yeah, no. I asked one patient who argued with me, what do you think that brown ring around your dick is? A beauty mark? No. It's a scar. To be fair, most people don't have the context for what a penis would normally look like. I know I didn't for a long time. Wikipedia. I'm uncircumcised, this thread makes me feel like a fucking unicorn. Edit. Guys, I'm European too. If you are going to say that it's common over here, 100 people have already said that. As a Brit I'm baffled by it. Most people here are uncircumcised. I've only ever known 2 men who were. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went BC, it doesn't bother her and she'll see if it gets better. I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that. 1. Getting my tubes removed did not remove my ability to get a period. 2. That we women have a urethra, a vagina, and an anus. Babies do not come from the urethra. This one was strange because she had me and my sister, so. 3. That when you neuter a dog, you just remove the balls, not the red rocket too. China, Taiwan's sex ed was severely lacking. So my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you, you can get pregnant. If you kissed a guy, you could get pregnant. I'm still finding out, years later, misconceptions that my poor mother has about reproduction and explaining things to her. I'm not a doctor, but I suppose this is related. My mother, before she had kids, grew up not even knowing that you could breastfeed a baby. She was never told anything about what breasts were for, sex, and even about homosexuality. Her parents never talked about any topic that was considered taboo. My mother learned about that once she had her first baby, subsequently at 16. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. So, not a doctor, but I work at a hospital. We had someone come into A&E because they needed their nails redoing. They genuinely thought it was a good idea to go to accident and emergency to have their fake nails taken off and redone because they had gotten too long and become uncomfortable. Talk about being high maintenance. Had a patient in our high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. Obligatory, not me but my wife. She's a nurse practitioner and had to explain to a 40-year-old man that brown sugar did, in fact, contain sugar, and that is most likely the reason why he now has diabetes. The same man also adamantly insisted his wine consumption was not an issue because he only drank the dry stuff like Chianti, so it doesn't have any sugar. When my Phil was diagnosed with prostate cancer, he decided to deal with it by going vegan instead of getting actual treatment. He also cut out all sugar, going as far as refusing to eat corn because of the high sugar content, as the cancer feeds off of sugar. The kicker was that he was a raging alcoholic and would drink 2 to 3 1.5-liter bottles of white wine a day. Refused to believe that white wine is full of sugar because it doesn't taste sweet. SMDH. A conversation I recently had with my oncologist. Is it true that cancer cells feed on sugar? All cells feed on sugar. But is it going to affect my relapse chance? Oh, goodness no. A normal amount of sugar or fat in your diet isn't going to give any residual cancer cells the boost they need to re-establish, nor is any tumor going to grow, or not grow from lack of sugar. My mom tells it so much better, but here's a try. My mom was the head nurse at a clinic here in Houston in the 80s. She worked for an old World War II doctor that had gone into private practice, old school GP, when he returned back to the States. Well, one afternoon she told me that they had a patient come in that was running a high fever and was complaining of pain in her pelvic area. Mom also tells me that there was a stench coming from the woman's lap that could only be described as enough to gag a maggot off a meat wagon. She begins to interview the patient, who told her that her and her boyfriend had been sexually active and that she has been in pain since. She thought that the woman may have contracted an STD and asked her to undress and wait for the doctor to examine her. The doctor arrives and closes the door, only to reopen it a few seconds later, mentioning about the need for fresh air. The doctor noticed that there was a vaginal discharge, began to question the patient about her sex life, was it protected, non-protected, etc. According to Mom, the patient told her, "No doc, we always use a rubber." The doctor looked down, then noticed that there was a small rubber band extending from the woman's vagina. The doctor reached in with his gloved hand and pulled it out. What came next can only be described as a magician pulling the magic cloth out of someone's mouth. One rubber band after another came out over the course of the next 10 minutes. Finally, once they were all removed, the doctor had the talk with the woman about sex education and that rubber bands were not a successful contraceptive and not what they meant by wearing a rubber, and then wrote her a prescription for ABX. TLDR, Mom was a nurse who had a patient use rubber bands as a contraceptive device who ended up with a severe infection and required medical attention to get them removed. To be 100% serious, this is why proper sex education is so critically important. I'm a dental hygienist and once was telling a patient after a cleaning that she had gingivitis. She replies with, "I must have caught it from my boyfriend." Had to explain to her that it's because she doesn't floss enough. She was 36. Thanks for watching our video. If you like it, please smash the subscribe and like button to support the channel, so that we can create more quality content in the future.